Here we are. Where are we, Cecilia?
Here. In my basement.
We're here. Are we here? I mean, I'm here and you're there. Does that technically make
here.
us here?
I am here and ready to share so much.
How much? Who are we?
I ask myself this every day.
That is an existential question. Who we are right now, we are the Unhinged Hygienist.
So welcome back, guys.
Hey, your dog's unhinged too.
My dog. Can you hear her?
She
a
wants
leaf
to be
must
part
have
of
blown
it.
by the house, and she is in protect mode. Like, protect the home from the leaf that has blown by.
You got to watch those leaves. These are crazy.
So yeah.
But on
Welcome
that note,
back to the Unhinged Hygienist podcast with Tasia
and Lauren. So on the Unhinged Hygienist, this is where we talk about conversations that healthcare and dentistry, they usually avoid them, but we don't.
Can I just say that, you said chin, and since Lauren is a myofunctional therapist, we know where her brain is.
I was just filming some videos, so my brain is really on myo right now. So please forgive my myofunctional slip-ups. This will be a fun episode of chins and myos.
Yes. Love it. But today's episode is one I think almost every hygienist has felt at some point in their career. I feel like maybe more now than ever. But
Yes. What we're going to talk about today is the feeling of being undervalued and underappreciated as hygienists.
yeah, I totally undervalued. I feel that underestimated. That's a big one. Dismissed. I think that's very much true. It's almost like our role somehow is less than, even though we are so we're responsible for so much patient care. So much.
More and more, it seems. And yet the respect levels keep going down.
Absolutely.
And, we really wanted to have this conversation not to complain or to be negative in any sort of way, but we really wanted to ask why this exists and how it even got to this place to begin with. Yeah. How did we get to feel undervalued? And is there anything we can do about it?
And I want to add to, it's almost like you said, like we're doing more and more. Mm-hmm. So it's almost like, again, they liked to keep us in that little box of this is your little role and this is what you're going to do. But now that we're learning more, we're implementing more, we're seeing that oral systemic connection and we're trying to connect those dots. It's almost like shut down. Mm-hmm. Because remember, prevention doesn't make money.
Oh, that's right. We kind of want you to stay sick. So then you need your filling and you need your root canals and you need your implants. But, oh yes, there's no money in prevention.
No.
So, hey, hygienists who are preventative healthcare therapists, remember, don't do your job, but do your job, but stay in your job, but don't be expected to do more, but do it faster.
Faster. Because I feel like people forget that we are highly educated providers. Mm-hmm. We're assessing, we're not just cleaning, we are assessing inflammation. We're assessing like periodontal disease, the oral systemic connection. We're going through medical histories, airway, sleep, oral cancer screenings, nutrition, your salivary health, because your gut does start in your mouth. So if your saliva is not healthy, there's a lot other stuff that is going on in your body. Yet people as a whole, and I don't think people I even like healthcare providers reduce us to the girl who cleans the teeth.
Yeah.
We are the janitor of the mouth.
Yeah. We're just the cleaning ladies. And I mean, I think a lot of us silently, or maybe not so silently, carry a lot of frustration about this. And this is what will lead to burnout and just generally frustration with being a hygienist.
Yep. We're the cleaning lady or the tech. Oh, you're the assistant. No, we're not any of those, but thank you. Let's educate you. Let's educate you on what we really are.
and what we actually learn. And, that's
especially when you know the level of responsibility you hold with your patients every single day.
Mm-hmm. Now, we know how smart we are. We know how much schooling we've went through. So why doesn't that translate into the general public? Where do you think this perception of us just being cleaning ladies actually came from in the first place?
So I was actually looking this up, researching recently. And it's sad, but here we go. Okay.
Okay.
I think a huge part of it comes from how dental hygiene was originally created. It was a profession started as more of a supportive role within dentistry. The dentist was viewed as a provider,
Mm-hmm.
and the hygienist was viewed as the assistant helping. That's it. We were like
Yeah,
the helper.
right.
We
I
weren't
guess
really.
the hygienist was the original assistant, right? And then we just happened to also be the cleaners. But people don't realize that the role has dramatically evolved. What we've learned, what we're responsible for, and how we've continued to connect the body and kind of brought it back to being whole wellness. And what we continue to realize and try to preach every day is connected the mouth to the body, but somehow that didn't evolve with it.
And you're going to hear us saying a lot of that throughout pretty much almost every episode because
Mm-hmm.
it
It's
is
our
all
theme.
connected. And I think we need to get that through to some people that you can do more because science has advanced, education has advanced, responsibilities have advanced, but culturally, people still think of hygienists the same
Mm-hmm.
way they did decades ago. And that's why I feel like it's like we were always, again, in the box, and that's why we are unhinged.
Mm-hmm.
It's like keep the
That's
hygienist in the little box. We're just going to clean teeth,
it's
and that's
true.
it.
I
But
remember I actually had an experience where I had a patient, after reviewing his medical health history and realizing that he had high blood pressure, he had high cholesterol, and a family history of heart disease, and he had rampant perio. The dude got out of my chair, went to my boss, and said, "You need to tell your little hygienist to stay in her lane." And I was like, "Oh, but where did the separation come from?" I mean, because clearly I don't think the patients actually know what we're looking at clinically. We've made it so casual and such a cleaning experience and such a comfortable, friendly experience that they don't realize we're assessing them and we are not just doing a cleaning.
yeah, no. But I think patients, it's almost like you're just going to get your car waxed.
That's true. Well, and I mean, a lot of people think that the rubber cup and the air polishing is the cleaning. And I'm like, no, no, me scraping the barnacles of disease process off of your face, that's the cleaning. The other
I,
stuff is just
I had a
aesthetic.
patient once. I was like educating them, and they literally turned to me and said, "You need to shut up.
Oh,
I don't want to hear it anymore. Just
oh,
clean my teeth." And I was like, okay.
noted.
And of course, at the end of the visit, they go to the office manager. "Oh, I only want to see her from now on. Why? Why?
How does that
Why
happen?
do you want
Why
to
is
see
it the
me?"
ones? I don't think we hit it off. There are other providers. Would you like to see anyone else, including the office next door? Sheesh.
But we'll definitely
No.
have an episode of just those moments because I think.
Yeah. Oh,
And
I
if
think
you
we'll.
guys have any of those moments, send them in
Dude,
because I think
this
that
is a
would be.
request.
Yes.
Please send us your stories. Send us your stories. Send us your favorite like oh my god moments in the hygiene chair because we will definitely read them and make them part of a podcast. That'd be amazing.
That might be like episode 1, 2. There's going to be like,
Multiple.
yeah,
Yeah.
for sure.
Yeah, it's
There's
true.
probably a lot. But don't forget, guys, that we are healthcare providers and they just see a cleaning. But what we are seeing is inflammation, bone loss, recession, airway issues, clenching, dry mouth, acid erosion, nutritional deficiencies,
Speaking deficiencies.
and
Don't make us.
bacterial problem. Stop it. Bacterial patterns. We see it all day
It's true.
long. Everyone's different. Not one patient is the same.
And yet somehow people think they can be treated with a blanket. But we're literally assessing the oral health of each person with their medical history, with the human being that is sitting in front of us every single day.
And we see changes before anyone else
Mm-hmm.
does.
Oh,
We
yeah.
can tell sometimes, are you pregnant?
Oh, yeah. Are you diabetic? I mean, and that's the part that people don't talk about enough. And, fortunately or unfortunately, patients see us more than they see their nurses. They see their doctors. Like they come to see us sometimes 2, 3, 4, 5 times a year. And yet we're not supposed to step out of our box and actually talk to them about what we're seeing.
Yeah. No,
Hmm.
very, very true.
Mm-hmm.
Because like you said, I don't
Mm.
recommend 6-month prophies.
Why is that, Tasia? Why don't you recommend 6-month prophies?
Did you know where the 6-month prophy, Lauren, originated?
No, I actually didn't. So I think that you should educate all of those out there. Let's have a
Guys,
teaching moment.
please
Bing.
listen. Please listen to this.
Oh, this is going to
The
be good.
6-month prophy originated, and I'm sure people do know this some, but it originated in 1930. Pepsodent made a commercial, "See your dentist twice a year." It was a marketing campaign for Pepsodent because what is it? It was when I
Like
can't remember the
iridium
name.
or
Iridium,
something like that. Some
iranium, not
fake.
something, but which is technically sodium lauryl sulfate. I can't speak English today clearly, so I am
Can you say
trying my
sodium lauryl
best.
sulfate in Greek?
So I don't know. I have no idea.
Okay.
Sodium lauryl sulfate. So basically, insurance like grabbed onto that and they just stuck with it. Guys, there is no scientific evidence that a 6-month prophy is beneficial. Bacteria grow every 90 days.
Yeah. Oh, so is that why we do a 3-month recall after we have diagnosed periodontal disease? Because you are no longer in a prophylactic preventative state? What? Tasia, how dare you go against our insurance gods?
And I'm like, why does oh, insurance doesn't cover it. So you mean to tell me we charge normally what we're contracted with insurance companies. So you mean to tell me even one extra cleaning a year, you cannot pay like
Yeah.
$70?
Yeah. 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 But I see that purse and I see that Starbucks. Why don't you give me like 10 Starbucks every quarter and you'll pay for your cleaning? And you'll thank me because we're keeping all those sugar bugs off of your face.
And I call people out. I've told women, I'm like, how much does it cost you to do your nails every month? Like $100? So you mean to tell me you can pay $1,200 a year to have your nails look good, but you can't pay $140 for 2 extra cleanings?
To have your entire
Somebody
health.
please explain this to me.
Well, I think that's a golden opportunity for us, right? And we don't want to shame our patients, but I think we need to help them with their perspectives. I mean, I see it every single day. We look at and we have guaranteed we've assessed you on the way back, right? Like I see your nails, I see your hair, I see your purse, I see your car. I listen to you just tell me how you got back from Hawaii, but yet you can't afford to do the filling. You can't afford to do an extra cleaning. But I think this is where the disconnect is, and that's literally what we're trying to preach about today is maybe this is where the undervalued part comes in because even they undervalue their dental hygiene. So perhaps we, the hygienists, have become undervalued because it as a system has not been valued in general. I mean, why? But I think to your point about seeing them more often, that's when we have the opportunity to kind of build that relationship and
Yeah,
let them know exactly what we are assessing,
that's
you know?
true. Yeah. I don't know,
No?
but some things need to change. So, but I just hate when people say, I'm just here for cleaning. Just here for cleaning.
Oh yeah, that's a very damaging statement. And I think it's all the dental memes, right? Like you've got a mouthful of grossness, you just want a whitening or you just want a cleaning or whatever. So I think the damaging is a good word, actually. I think one of the most damaging phrases is when people say, I'm just here for my cleaning. I'm not here for anything else. Don't talk to me about anything
Yeah.
else.
But people don't realize inflammation is not isolated.
It's not.
No,
You mean your mouth is connected to your body?
no,
Are you
yes.
sure?
Yeah, I believe it is.
Huh. What's that fun little fact you love just to throw out that the mouth is the only part of the body that has been considered not actually part of the body? Like, how did it become disconnected?
It's
Is
the eyes and the mouth have been forgotten I think dental should be covered under medical. I think
because
the
it
whole
is
body
medical.
should be covered under medical.
It's true. Yeah.
And like periodontal disease is an inflammatory disease process. We're talking about immune response, people, bacterial load, cardiovascular implications, diabetes, pregnancy. Like this is health care.
What?
Yeah.
Healthcare. And see, and this is what's frustrating because you and I know that, and everyone listening knows that, but yet somehow we're still perceived and assumed to be just production machines. We're just there to churn out money and cleanings and whatever. So
Yeah. Less time, more duties. who's losing in that situation, really? The patient.
Yeah, that's true.
You
Yeah.
know, I had a patient last week say that her cardiologist told her her AFib was caused by obstructive sleep apnea.
What? Well,
You
that's a
know,
good cardiologist.
because
Thank you.
obstructive sleep apnea increases your chances of AFib times four.
Yeah, because I would have to think that if you're deoxygenating multiple times a night, that could have an effect on your cardiovascular health,
Hmm.
which does start curiously in the mouth, which is in the body, which is an area that we work at. So when we tell you there's clenching and grinding signs, when I see your scalloped tongue, when we look at all these things, we talk about your dry mouth, we're not just talking about your mouth, people.
Yeah, yeah,
Like your patient. Your cardiologist got to point it out.
yeah.
So,
Which I was like, this is amazing. Side note, because I just want to throw this in. I also had a patient last week. We went over medical history. He was on metformin. So I was like, what's your A1C? And he's like, well, my doctor told me I'm pre-diabetic. And I'm like, okay, what's your A1C? He's like 9.1.
oh, wow. That's pre? Wow.
And and I said well, I think it's time that you find yourself another doctor. 9.1 is not pre-diabetic. I'm like, you are in diabetes, my friend.
I mean, was the 9 flipped? Was it a
No,
6.1? I mean,
no, it
wow.
was, yeah. So,
Oh
but
my
again,
gosh.
we're dealing with all of this, going through medical histories, trying to connect the dots. Every patient's different. We're also therapists. There's just so much that we do in one
Mm-hmm.
appointment,
Mm-hmm.
but yet we have so much pressure to stay on schedule
Mm-hmm.
and produce. Like, it's really ridiculous. Like, we're not production horses, guys. We are
Mm-hmm.
healthcare providers. Now, and I'm going to say this, wait for it, because I might ruffle
Brrr.
some feathers, but if your insurance company is paying $50 to $60 for a prophy, but you want me to produce 3 times my hourly, that's not my problem. It is not
Mm-hmm.
my problem that you decided to take insurance that pays barely enough to pay your hygienist.
Yeah. That's the truth. I think to your point right now is the system at large is pointing at us as if we are the issue. And I'm like, why isn't anyone pointing at the insurance company? The fact that you're not being compensated in this usual and customary, who decides that? It's some hotshot MBA who's on the other side of a data cruncher, not the person who's actually clinically looking in the mouth. Like, why are we expected to uphold these numbers, but the insurance companies who make billions of dollars aren't? We're not here to create profit and production. I'm here to keep the person in front of me healthy. I mean, is this what people do in the medical profession? Do you have your nurse being told you need to prescribe so many kinds of drugs and this, that, and the other, and numbers, numbers, numbers? Like, how
I'm
again?
sure
How did
to a
that happen to
level,
hygiene?
I'm sure in medical, doctors do get money from prescriptions, right? So
Yeah,
again, this all stems down from, we're not
insurance,
here to keep us healthy. Like
production.
the
Yeah,
insurances are not here to keep us healthy.
no,
Insurance can also make fraud, but yet we're not allowed to. So,
yeah,
because
denials.
if you do 4 bite wings and 3 PAs, they consider that an FMX. That's insurance fraud.
How is that? That's not it.
Yeah. So,
What?
yeah. But,
Anyway. So, yeah, on
but
that note, not
yeah,
we just can't do everything we want to do for patients. We don't have the time, we don't have the backup, we don't have
we don't.
so
And
what do
how
we
many
do?
times have you been told that we're lost leaders?
I think I
Again,
was told
because
that
you, as a
recently.
provider, are taking insurance that doesn't
Mm,
cover our
mm,
hourly pay. That's
mm-hmm.
somehow our fault.
Yeah. Yeah, yeah.
But,
Yeah,
you
right.
know,
That's my responsibility.
yeah,
What you did with your business practice is somehow my responsibility.
yeah.
Okay.
But yeah, prevention is undervalued.
Completely agree.
Yeah.
And I think healthcare systems are often built around treating disease once it becomes severe enough. Oh, we have to watch it until it becomes something that we can fix instead of preventing it in general.
And that's why I tell people, oh, my insurance doesn't cover. I'm like, your insurance only is going to cover a healthy prophylaxis. It's not going to cover full disease. That's why prevention is so
Mm-hmm.
important.
Mm-hmm.
And hygienists, we are prevention. We are the
That
epitome of prevention.
That's it. That's literally what we do. I'm not here to help you encourage. We are here to stop the disease progression before it gets worse and spreads into the rest of your body because it is connected, people. And once you have bleeding in the mouth, guess what has just happened? All that bacteria has gone into the lazy river of your bloodstream, which is why I don't understand the face that we get when we say, hi, this is connected. And the bacteria in your mouth is going to affect your heart and your joints and your brain. And why? It's connected, people. Prevention.
Yeah. I had a patient with an abscess in his mouth, and he just wanted, he's like, we'll get, take care of it. And I'm like, and then he wanted to wait because it was like, it comes and goes, it comes and
Oh,
goes. I'm like, if that was on your arm, I said,
mm-hmm,
I'm like, would you go to the doctor and make sure that it was taken care of?
mm-hmm,
And he's like, yeah. I'm like, so why is it okay
mm-hmm,
for it to be in your mouth
mm-hmm.
where you're
Exactly.
swallowing this? I'm like, do
Yeah.
you know where your brain is?
Yeah. Yeah. You're
Was
3 inches above
close.
this
Yeah.
chronic infection. No biggie.
But
Yeah.
but
Yeah.
but prevention, it's quieter. It's not dramatic. Patients don't
Mm-hmm.
always see what you prevented from happening. And I think that is
Yeah.
a big thing too.
You're exactly right. Yeah, nobody's celebrating what didn't happen. Nobody's saying thank you for avoiding the cavity. Thank you for avoiding the periodontal disease. Thank you for catching the oral cancer that could have been something severe. Like nobody says thank you for what we avoid. And but we say thank you to ourselves because we know what we're doing and you know, say thank you people. We're here helping you.
Yeah, that's true. And prevention it's not always immediately visible,
Mm-mm.
and it might not ever be visible because we've prevented
Because
it.
it's been prevented. Yeah, exactly. Yeah.
It often
That's the
gets
goal.
financially and culturally, again,
Yeah.
undervalued.
Yeah.
So,
Even though prevention is absolutely one of the most important things in healthcare in general. Hmm.
hygienists save patients from future health complications like every single day. And again, it's silent because even with kids with airway issues, and you would know, like, if we fix those issues between the
Mm-hmm.
ages of what they say 3 to 7 is like the
Mm-hmm.
most important time.
Mm-hmm.
Maybe that child isn't going to grow up to have heart disease, AFib, other
We can hope.
metabolic issue. You don't know,
Yeah.
and it might be
Yeah.
because it plays a huge role.
And I think sometimes that's why we have to do something. We almost minimize what we're preventing because often I will say something to the effect of, I'm going to help you possibly avoid your children getting braces and saving you money in the future. But all they're thinking about is the aesthetics of it. But if we can help children develop and grow and be healthy, we're having an entire generation of just generally healthier
Yeah.
people. But because it's prevention, it doesn't get noted. And so I don't know.
So many episodes we're going to have on just,
There's so many. There's so many. But
and it's not just dental. This is across the board. I even was talking to a patient who works in an oncology clinic, and she's saying the same thing. Like, there's stuff that the insurance doesn't even cover, like the stuff that they need. Like, everyone's losing
no,
money. So, but
no,
but Delta Dental CEO makes $5 billion a year, and you still
we're
get
not.
$1,000 a year coverage, which has been the same for 20 years.
Yeah. So don't be mad at the doctor's office when
No.
you're like, what do you mean nothing's going to be covered? What do you mean
Mm-hmm.
I only have a $1,200 maximum for the year? Like, what can
Yep.
you, but yet your medical health insurance is going to be $1 million for the year and, whatever. But
Yep.
I don't know. Do you think this is just an insurance thing? Do you think it's a hierarchy problem? Do,
I think
what's
I
coming?
do. I absolutely think that hierarchy problem for sure.
Same.
And this isn't about attacking dentists.
No.
There are incredible. I've worked for some
Mm-hmm.
really great dentists who
Mm-hmm.
deeply value their hygienists. Are there? I wish there were more, but historically, dentistry has often functioned in a top-down structure, and it's
Mm-hmm.
true. So
And although we're told it's an open door or it's, free to speak, I think hygienists in general, because of the culture that's been created, we're afraid to speak up oftentimes. So we're speaking up here.
We are. Listen, here we go. But yeah,
Hmm.
exactly. Hygienist, we're trained to stay quiet. Me and Lauren, we don't fall under that category.
We were trying to
Uh,
stay quiet.
Follow direction. Yeah, no, we like to push those limits as far as we can because we both really
mm,
value creating health,
mm,
educating, advocating, helping patients advocate.
yep.
We're taught not to challenge treatment philosophies. Yeah, not us. So
But yet we're
I
taught
will
to,
print out articles.
yeah,
No, here, no, this is what it says. Please
God
don't
forbid.
irrigate with chlorhexidine, guys. That came out in 2018. I can't.
What? Are you
I
following
cannot.
modern science? You stop that.
God.
I think that's what's frustrating is we are told that we have to continue to learn, but yet whatever we learn, if it doesn't want to be implemented, and I think maybe that's the frustration of most hygienists, how we don't get to work separately. We're not in our own clinical settings. Um, it's cute. Like we get patted on the head and we're like, we're so proud of you for learning whatever you're learning. But I genuinely believe, and I've been told this multiple times, and it's been the culture that we're all just widgets. We're all just replaceable tooth cleaners, and I think that ultimately silences us. It makes us shush.
Philistines.
It does that too. It makes us lose our words like that
Yeah.
because what's the point? I mean, I feel like sometimes we feel like we're beating our head against a wall being like, "Please update yourself." And then yet we're giving post-it notes, we're printing out studies, we're trying to help our patients. We have to do it quietly.
It
And why is that allowed? Why have we been forced to be like, hey, I just want to give you this information secretly. Did you know your mouth is connected to your heart? You should probably talk to your cardiologist.
yeah,
Like, that's
right?
wrong. It's wrong that we have to help people in silence. And
If anything, like we should be like hygiene and the dentist should be so like cohesive in how they
mhm,
diagnose and
yeah,
treatment plan. And
yeah.
I have worked in offices where it has been like that and it is amazing. Like
Hmm.
does it happen all the time? No. Do I have that now? No. I don't.
Cohesive environments are
Um,
unfortunately a lot harder to come across.
and that's where we get shut down,
Yep,
because I am not going to
yep,
sit here and take pictures and take an iTero scan and show them this, and this probably needs a crown.
yeah.
This root is, and then they come in and they're like, everything is fine. I am not going to devalue me and who I am and
Hmm.
what I say
Hmm.
every single time. Like I'm not, and that's where like a lot of us kind of I get stuck in again in that little
Hmm.
box, and I'm trying to like, because I'm very vocal, and sometimes I
Hmm.
say things that I probably shouldn't, and whatever. You're gonna hear it from me. I'll tell you that. So, but I feel, and it affects identity. It affects whether
Yeah.
hygienists truly see themselves as healthcare providers, and I think that is
Hmm.
a big issue. And I'm not going to sit here and say, because there's a lot of hygienists that could do better, but I don't
Yeah.
blame them. Maybe some, but I don't blame a lot of them because when you're stuck in that type of environment, like where are you supposed to go?
Hmm.
You're going to
I
give
think
up
they
at some
just,
point because it's
yeah,
like
yeah,
you can't win this battle.
no. Sometimes, well, I don't want people
Sometimes,
to
yeah,
feel that way. And
no,
I think that's what's happened, right?
yeah,
Is we've been squashed.
hmm,
And I think that if we as a group, as
yes,
a collective, the nurses did it. I
yeah,
think the nurses were squashed for a long
hmm,
time. And then they really had to fight to become like the nurse practitioner, the mid levels, and really be as respected and allowed to work independently because we are all here trying to make the
hmm,
patient better. And we're the prevention specialists. So, I mean, especially in a dental office, like you really want us to not just chat and polish because then I'm never going to find your work. I'm not going to take the photos. I'm not going to set you up for a full day of production
hmm,
because every time, if I'm afraid that every time I present this to you and I give you the proper warm handoff and you go, watch it, well, then how many times do you have to smack me on the nose before I'm going to
hmm.
stop talking? So, you
But I
know,
think
this is burnout.
yeah,
That's
it is
burnout.
burnout, but I think
Yeah.
that's where I'm not saying you can't win. I'm not saying it in a sense.
Yeah.
I'm saying that we need to come together
Yeah.
and like literally lift each other up instead of
Yeah.
like everyone saying
Absolutely.
this, or, like we need to come together and like build each other up and
Hmm.
evolve and stick together. And when like
Hmm.
we can do this, we are
Not
educated
only as
providers.
hygienists, but also as a dental team. I
Yeah.
don't I don't want to work in the environments where the assistants don't feel like they can talk to us and we can't talk to the doctors. We are a team. We are an office. We chose to go to that place 40 hours a week to help a patient live a better life. But yet somehow it's become an us versus them versus us. And I
And
mean,
I'm going to throw this in too.
do it.
Undervalued, again, dismissed.
Mm-hmm.
A lot of the team assistants, especially, even manager, like across the board, were difficult.
Who? Who? Us? No.
We're divas. We're very,
People don't see us that way.
oh, you want me to order this type of tip? I'm like, in my head, I'm like, yes, I need this specific tip for the perio DT. Oh, and then they have to argue it. If a doctor needs something, are they going to argue with them? Why are we seeing it like I'm trying to do the best job I can do? So how is that being difficult? But we're crazy. We're difficult. We're divas. This is how we're labeled in a lot of offices, and I
We're
think it's
demanding.
really
We're costly.
yeah.
What are we? Lost leaders. Ah,
Yeah.
lost. That's my favorite title. I just adore being called a lost leader, and I'm like, you realize I'm the one that finds your work, right? So if I need a special tip, if I need a different Cavitron, if I need gloves that actually fit my hands, if I want a mask that doesn't fog up my glasses, why are you telling me no? You'll let anybody else order a gazillion-dollar handpiece or a new composite material or upgrade the computer systems, but when the hygienist needs something, nah, you know. But I think that's our detriment is that we've always made do, right? And I think that we're really good at doing the best we can with what we have. And that's part of, again, our burnout because we're not speaking up. We're not using our knowledge. We're not saying this does not coincide with what I know to be true. So we just go, oh, okay. And we get silenced. This is what's happening.
But I also think we also, as healthcare providers, we need to stay motivated and do the right thing. You can't expect to do the bare minimum basics and then ask for all this stuff either. You know, like do the work that we are supposed to be doing in preventative medicine, because that's what we do.
Okay, so here, I'll go controversial on you on this one. Do you think there's another layer to this sort of subservient attitude and this helper attitude because we are a female-dominated field? Because there's a few hygienists out there. Shout out, hygienists. We're proud of you.
Totally.
Because I think that's the problem. Is we're subdued, we're subservient, we're the assistants, we're the feminine energy in the office, and we're supposed to act a certain way.
Because the majority are women, but I've worked with some amazing hygienists, but there's some patients that do not want to see a male. And I'm like, why? There's male nurses. I do think that hygiene, and I feel like nursing too, but not to the extent, is, yeah, it's a female-dominated profession. We are perfectionists as well. I know I am. That is a trauma response.
Yeah, well, that's okay. But yes, I mean, yes. So I mean, nursing, caregiving, those have all been that similar pattern, and I think that it took a long time for people to respect. I mean, we could even go back to Meet the Fockers, and it's like, why are we mad at him for just being a nurse? Like, being a nurse is great. Being a hygienist is great. I specifically chose to be a hygienist, and I know you did too, even though you wanted to go into marketing and nursing and newscasting and everything else, but whatever.
I'm a Gemini. I am a Greek and I am a Gemini, and I have self-diagnosed myself with ADHD. So
see, you're all over the place, and that's why we love you. But I think I chose to be a hygienist because I wanted to help people be preventative. We are smart enough to be the doctor, but we didn't want to go that route. I don't want to fix you. I want to help you feel better. Yeah. And why is that not allowed? Like, I don't know. It just makes me frustrated.
Caregiving professions have always been led by women. You know?
And
we've been viewed as, it's like a supportive role instead of like an authoritative role. I think that's a big one.
And what's frustrating about all of those roles, caregiving, nursing, hygiene, all of the ones that are female, quote unquote, led, is they require enormous amount of skills and knowledge and educational and emotional intelligence and clinical knowledge. But yet somehow it's not appropriate for us to actually implement all of those parts of it.
Yeah. And hygienist, like, I don't know where these accents are coming out of my mouth. Hygienist. Like we manage physically, emotionally, clinically, psychologically all day long, guys. It can be like I come home and I'm like, I don't want to talk for a while. Like I
No.
am like I need to like decompress. It's
And
a lot.
it's the thing that people don't understand. We're in a patient forward world. We don't hide behind a computer. We don't get to, we have to compartmentalize everything. It doesn't matter if our dog died on the way to work. Like we have to shut that off and we have to be like, "Hi, Mrs. Jones, how are you? Tell me about your grandkids." You know, we
Yeah.
have to go through these days and put our best foot forward because you trust us. Patients trust us deeply to
Yeah.
do our best no matter what is happening in our lives personally.
Like my dad passed. I was at work 2 days later.
Yeah.
My dog died. I had to put her down Friday. Started a new job Monday.
Yeah, yeah. Oh,
You
it's
know.
like I supposed to take it as a compliment when I went all the way through my divorce and everyone in my office was like, "Wow, I had no idea anything was going on." And I'm like, "Well, you're welcome." Because that's what I have to do. I have to put on my professional
Yeah.
face and I have to come to work and just turn my tears off in my car and then
Yeah.
get to work. You know, hide it under a mask and loops. But
Yep.
I don't know.
That's
How do
that's
we
what
change this? Like, what actually needs to change going forward? What do you
I
see?
think
Talk to me.
we need to stop minimizing not just our roles, but we need to stop minimizing ourselves as healthcare providers.
Absolute 100%. And
We,
go ahead.
no, I
I don't
said
want
we
to
need to
stop you.
like we need to fully step into the identity of like we're healthcare providers. That's it. That's all I want to say. We are healthcare providers. So stop minimizing. We're not like, oh, the glorified assistant, the tooth cleaner, the whatever. We are health. We are part of the healthcare team, guys.
Yeah. And I think the call to action that you and I really want to put into maybe less or more articulate words right now, we're going to use our big words. I really want to encourage people to please learn and please learn something new and different because what we're taught in school is basic. It's just enough to get us past the board exams and get us our license, but it is up to us to be curious. Please stoke your curiosity. I don't care if you want to learn about veterinary hygiene, if you want to learn about airway, gut health, any of it, if
Yeah.
anything, take a variety of classes. This is why I really love those our great hygiene focused conferences. I love RDH under one roof. Like when you went to Boots and Biofilm, when you went
Yeah.
to the Scholar
IDM. Yeah.
Society, when we have the AA, everything, every airway course and anything that's ever been curious. I might not think that it has anything to do with me, but I'm going to take a note and go, that's curious. I remember I was at a course for airway and I was listening to an occupational therapist speak about primitive reflexes. And I was like, I have no idea what that is. So then you kind of go down your own rabbit hole. And that's how you avoid burnout. But I think that's also how we can shift the perception, right? Because if we keep learning past school, then we can bring this to our office. We can bring it to our other hygienists. We could do this kind of conversation and just
Yeah.
get our fire going again.
Yeah,
So,
and I challenge everyone to do
yep.
that. Don't take your just regular free CE courses just to get
Yeah.
your
Yeah.
licensing. That
Don't be afraid to
actually
pay for a course
pay.
because
I pay, and I that's where you get like
pay a lot.
really good information. You connect
Yeah.
yourself with really great
Yeah.
providers who care, and that's
Yeah.
how we can build that system and create that shift
Yep.
in dentistry. And
Absolutely.
you
I
can't do
think
it by doing a free course on stuff we already know how to take
you can
x-rays. You know what I mean?
sometimes, and I think there's a place for it, especially for new grads or maybe for old grads because we have
Sometimes I
forgotten the
would love to take
basics.
a pathology course because sometimes
Yeah.
I'm like, damn
It's
it,
true.
what part of the tongue is that?
I love taking, yeah, right. What part of the tongue is that?
I
What's a
forget.
papillary, whatever. I really enjoy doing refreshers for anesthesia.
Yeah.
I'm always like, ooh, what's the new trick? Like, how can I actually get somebody numb faster?
Yeah.
But
And
please,
but at the same
learn.
time, challenge yourself with some, there's some great stuff out there, and some of it does cost money, but maybe your provider might help out,
Yeah,
some
and you don't
do.
know if you don't ask, right? So
What's the worst they
what's the
say?
worst thing
No.
that can happen? Exactly. What are some of your favorite things? Like, what are your subjects you want to encourage people to investigate here?
I'm fascinated by autoimmune diseases. I'm fascinated by, again, your gut starts in your mouth and leaky gums, leaky gut. I'm like, people
Yep.
need to realize your gut health and your immune system is one
Yep.
cell layer apart.
One
One cell
cell
layer.
layer thick.
And now they're saying too, the majority of autoimmune diseases are caused by leaky gut.
Mm-hmm. Oh
Because
yeah.
even with me, I'm still not, I don't really have a diagnosis. I make up my own. But once that immune response gets activated, like you're there. So now it's
Yep.
too late. You are
Yeah.
there. Now,
Yeah.
are there things you can do? That's a whole other episode. We have a great guest speaker for that. But because women are pretty much gaslit when it comes to autoimmune diseases, but I find autoimmune disease, like how your body attacks itself, to be so fascinating. And a lot of it, this is like my little, I'm going to do this quickly, but like everything is so sterile these days, like sanitize. Your body hasn't learned to fight off like what it needs to, and it gets
Mm-hmm.
confused. The signals get confused and they don't know what's you, what's not. So now we're just
Yeah.
going to like attack everything.
Well, and on
Diet.
top of that, we're in this chronic toxic overload environment.
Yep.
Our food is sick, our air is sick, our water is sick. So now we've like over sterilized our body, but then we can't fight the crap that's being
No.
artificially given to us.
Yeah, our
Yeah.
body's like in a state of confusion. But yeah,
All the
I
time.
love gut health. And that's why people are like, oh, how do you know all this? But I'm like, dentistry has evolved, and thank
Yeah.
God it has. Thank God
Yeah.
medical has evolved, because 20 years ago they
Yeah.
used to tell you your gut has nothing to do with anything, and now we
Yeah.
know it has everything to do with everything. So I'm very passionate about autoimmune, inflammation, gut issues. That's like I love that.
Good. And what the point is of all of this is that hygienists, you and me and our fellow hygienists listening to this and everywhere around the world, we belong in those conversations. We are part of the healthcare team.
We are, and
Mm-hmm.
we need to stick together and make these
Mm-hmm.
changes, because I feel
Mm-hmm.
like we need to close that gap. Like we are part of the medical team, and I should be able to call doctors and say, patient's A1C is 13. They're bleeding everywhere. What are we doing?
Mm-hmm. Yeah.
Like we should be able to communicate with each other. And it shouldn't be like this ego thing of like, this is a
Oh.
hygienist. Again, we're all here
Mm-hmm.
to help patients heal.
Mm-hmm.
I
Yep.
would hope.
Collaboration in the name of having a healthier patient is what we're trying to do. So,
Please stop
you know,
undervaluing us.
stop it. We need to feel
Stop.
respected,
Yeah.
supported, valuable, not only to ourselves, but to the patients and to the practice and to the doctors and to everybody.
And I'm
Because,
gonna I'm gonna throw this in here now.
okay,
Because when
do
you
it.
undervalue us and then you wonder, where have all the hygienists gone? I could sing.
Oh, girl, you just hit that nail on the head.
Where
Because who
have we
wants
all
to work in
gone?
that environment? I don't want to work in an environment where I'm not appreciated,
And
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 yeah,
I tell patients and they don't believe. They're like, "What?" A lot of us don't get medical benefits. A lot of us
no,
don't get sick days, vacation days.
no,
There's no perks, you
no,
know?
no.
So like what are we fighting like at this point? Like, and instead of wondering and trying to fix why we don't want to work, why we're
Mm-hmm.
leaving the profession,
Mm-hmm.
instead we're just like, let's train other people to do the hygienist job. Again, undervaluing, dismissing what it is that we
Because all
actually
we are is
do.
tooth cleaners. You
Because
just here, have a scaler. Go.
let's clean above the gum and just create periodontal disease rampant across the world. So
Yeah.
that's
Yeah.
my
That's a
closing
whole
statement.
that's another episode right there too.
Oh,
Yeah.
I'm so
That's a
excited.
fun one.
But
Oh.
just like we value you guys as like we just
Mhm.
want the same, and like let's work
Yeah.
together. We need to work together, and I know there's a lot that do, but for the ones that don't have that, like let's try to like help each other out.
Yep. Yeah, let's help each other out. Let's help the patients out because we all deserve a provider, every provider that looks at the whole picture.
Yeah.
Yeah.
So I challenge you.
Challenge all of us.
I challenge you to start those more difficult conversations.
Mm-hmm.
Try to make some changes where you can be more of a,
Mm-hmm.
connecting those dots, and see where it goes, and let us know if you need anything, any support.
Yeah.
We could try to help with what we've done or are trying to do.
Yeah.
It's
We
an
are
ongoing
actively
process.
doing it. Yeah, exactly.
It's not going to happen overnight, and
We have to have a shift amongst ourselves, a shift amongst the culture, a shift amongst healthcare and wellness in general, because, at the end of the day, being a healthcare hygienist is seeing the person behind the mouth, but then also being a healthcare hygienist is seeing the hygienist behind the cultural and sort of missing identity of being undervalued, underappreciated, because I know there's days where I find all the value in the patient that has said, thank you for doing that. Thank you for helping me.
Yeah.
And you know,
I love that. That literally makes me feel like I did my job. Like this.
Yeah.
These are the moments that I live for.
Yeah.
And I love, because I'm helping someone. And even if you might not be helping them, they might be telling someone else. And now you've saved someone else's life in some way.
Exactly.
And that's all that matters to me. That's it, so.
That's what matters to your dog too. Agreeing. Well. But because I think the reason we went into hygiene, right? We wanted to be healthcare providers. We wanted to help people help themselves for different reasons, whether it's whatever it was that was your motivation to become a hygienist. Anyone out there listening, I think that now that we know, and especially because this isn't 50, 60, 100 years ago. This isn't just when we were polishing teeth and making the tobacco stains go away, whatever. Like now we are literally looking at the entire body. And people, I think it's one of the best things that have happened since COVID is people start to take their own health into their own hands and they're taking more responsibility. So, again, we're looking at not only the mouth, but we're looking at the person attached to the mouth.
Exactly.
So, yeah.
No. And I love how, we try to make these episodes like not too long. But me and Lauren have a lot to say.
It does. We do. It does. It's all of it. Yeah. I don't even know how to put my thoughts together sometimes because we just start on these subject matters and, it
goes in all different ways.
Correct. Well, and that's why I think
so.
that I love that we're doing this because I think it's going to, if we're feeling this, we're two people on two opposite sides of the country who have had 20 plus years of experience in this field. We are not alone. There are people who are going to identify with this. And if we can just help anybody, I want to help us help ourselves because I love being a hygienist and I love what I do because I know every single day I get to help people feel better and I get to help people educate themselves. And like we've said in previous episodes, like when you can educate a patient about something they've never known, like your diabetes guy, like he has no idea clearly how important his A1C is. Yeah. It's crazy that people don't know this and it's up to us. And we have the gift and the responsibility, but the privilege of really doing this. And we are advocating for ourselves and we're advocating for our patients in a system that has not fully caught up to what's actually happening and what's out there.
Yeah. So to every other hygienist out there listening, don't give up. Find something that you're passionate about and learn about and just, we want to get you excited again about doing hygiene. Yeah. And maybe that excitement will kind of bleed into everyone else in the office. And it's everyone will get excited or maybe go do something together as a team, but don't give up because our job matters. What we do matters.
Yeah, absolutely. And don't shrink yourself. Don't minimize yourself. Don't minimize what you've learned. Don't minimize your contribution to not only the office, but the patient's health.
Because we value you.
Yeah, we do. And we're not just tooth cleaners. We're healthcare providers and we're healthcare hygienists. So
that's right.
There you go.
But
I think that was a good rant.
That was great. And honestly, thank you to everyone who's listening.
I hope this motivates people.
Yeah. I hope it motivates. I hope it encourages you to do more. Yeah. Please reach out if you have any topics or anything, or if maybe you want to be on the podcast. Just reach out to us at the Unhinged Hygienist at gmail.com. We're on Instagram. If you go on our Instagram account, there's the beacons list that lists all our social media and also Lauren's website. But yeah, thanks again. Thanks for the support, for being here because I'm really truly excited that we're doing this because I think that it matters and I think we need a platform for getting people together and elevating our profession.
Absolutely. So thanks for being on the other end of this microphone today to see.
I miss you so
This has
much.
been a fun conversation.
Yes.
So,
and
all right.
Thanks again.
Until
everyone.
next time. Okay. Mwah. This has been the Unhinged Hygienists. We're going to go creep back into our box now. Maybe not. All right. Peace out.